Mm.
Dr. Cassie McVeigh, welcome to the podcast. Well, this is the first podcast this year. What's the crack? How are you keeping?
Yeah, I'm pretty good. I suppose I sound pretty hectic at the moment. So just trying to get my kids back to school and working through all the stuff going on. And I work as a GP as well as doing menopause stuff. So kind of trying to sort that stuff out after Christmas is always fun and games. People need stuff looked at, maybe they put to one side, and trying to kind of get myself in a good space for the start of the year. So I'm kind of trying different things. I'm doing a bit of a social media disconnect at the moment, which is really nice. Trying to change a few things, going into the new year. So yeah, I'm good.
Have you noticed the mind being less active from the social media, like disconnect?
Do you know what? I was never on Facebook until relatively recently, like maybe a year, maybe less than a year. And I only joined it because I sea swim, and the sea swimming was organised through Facebook. So I kept missing all the alerts and things like that. And then I was trying to use my husband's Facebook to sort of sneak in the back door. And he kind of was like, for God's sake, just, sign up to Facebook, for goodness sake. So I did in the end. And then I ended up with the business and stuff. So I put it on there as well. And then Instagram found me, and I was just like finding that I was just spending ridiculous amounts of time scrolling through rubbish. And it was kind of like, and then the last couple of nights before I did this, I was just sleeping really badly. And my head just was so busy all the time when I was going to bed. Just, I don't even know what it was thinking about. And I normally sleep really well. So it's kind of one of my, I'm really proud of my sleep. I know that sounds ridiculous, but I love the fact that I get into bed and go to sleep. And I was kind of anxious that this was leaving me. So I was like, God, you know what I'm going to do? So I took my phone and I took Instagram off it, and I took Facebook off it, and I took all the alerts off it. And I took, I've gone through my email. So everything people are sending me, emails from shops or whatever, I'm just unsubscribing. And it's only a couple of days, but I actually feel way better. It's really funny, and I was like, what did I do before I looked at this the whole time, so and then I was reading an article in the Irish Times at the weekend about tech and how they're ruining our ability to focus. And I was showing it to my husband actually, and I was like, God, it's so true how you get, even no matter how strong you think you are, it's so difficult to, to resist technology, because they're so clever at getting us clicking and staying connected and things like that. So, so I was just saying about leaving my social media a little bit, which is great.
Congrats.
Yeah.
I recently purchased like an old Nokia phone, a Nokia 106.
Yeah,
and so it's my plan to. Yeah,
you're doing a Ryan Tuberty?
Because is that what Ryan Tuberty does?
Yeah. He doesn't have he has like a brick, I suppose, as we would call them. Yeah, for that very reason.
Wow, I didn't know that.
Yeah.
Okay. Yeah. Well, it's one of the few things that me and Ryan Tuberty have in common, I would say.
There you go. Yeah, well, you're both from Dublin, so I suppose that might be. And you like talking to people, so there you go. Yeah.
Maybe we have a small difference in pay bracket, but maybe that.
Yeah, that's true. Yeah, I think all of us and Ryan Tuberty have a small difference in pay bracket, but yeah, he's big into. And the funny thing is, I don't even post on social media, so it's not like I never post any updates or pictures of. I have a picture on my. It took me ages even to put a profile picture up, but then people were going, do you know, it's only like serial killers who don't have a Facebook page, and I was like, I think that's not true, but so apparently I've taken myself off the serial killer potential list, so by joining Facebook, but definitely, I just feel lighter. It's really, really nice. I just don't feel like I'm constantly going, oh, what did Vogue Williams do today on Instagram? So it's great.
Yeah. Great, fantastic. Well, that's a lovely way to start the podcast. Before we get into, Cassie, for listeners who might be unfamiliar with your work, do you mind telling us a bit about yourself and how you came to be doing what you're doing at the moment?
Yeah, sure. So I don't know how far back you want to go. So I suppose as I said, I started off as a dentist. I qualified probably, 2001 actually, I was thinking. And I did that for not very long, actually. I only did it for a year before I decided that I wanted to do medicine. And that was mainly, my parents were both doctors in Northern Ireland, and I'd always wanted to do something in the caring profession. And my dad had said to me that dentistry was a better job for a female, which sounds quite sexist, but I think, he was a man of his generation, and I understand why he would have said that. And he was right, But I got to the end of dentistry after 5 years, did a year of it, and then sat in a lecture and was like, you know what, this just is never going to go. I'm going to have to scratch this itch. So I went back to college in 2002. So I went to UCD in Dublin, and I did medicine then with a load of people 6 years younger than me, which at the time I thought I was ancient, even though I think it was about 26 or 27 or something. And now it's quite common for people to do medicine as a mature student. So I did that, and then I went straight on to GP training, and I completed that up in Sligo, because my husband is a surfer and it was the only way to ever spend any time with him. So I moved to Sligo, and he cancelled our first date too, because the waves were too good. So that was me given my ideas of where I featured in the pecking order. So we moved to Sligo, and I did the GP training, and then I ended up doing quite a lot of women's health. And then in recent years, my older sister, who's suffered a lot with her hormones over the years, she's had postnatal depression, and she's had a thing called PMDD, which is the thing called premenstrual dysphoric disorder. So it's quite like a really serious form of PMT. So she suffered from that as well. And because of that, she had read a lot about hormones actually, and she kept bringing these back to me, almost like a cat with a caught a mouse. She kept, this is really interesting, or look at this, you're going to really enjoy this. And for ages I was kind of like, and then eventually I started really looking at it, and I was like, do you know what, this is actually really interesting. And I had a whole kind of awakening to the menopause and to women's hormones in midlife and stuff. And once I started learning about it, I just couldn't stop. I just find it so interesting. So that's kind of how I got into it then. And then about a year ago, or a year and a half ago, I started kind of seeing menopausal women in my GP surgery, and that got really busy. I just put there you go, social media. We put a post up on our GP website, just sort of giving some of the lesser known symptoms of menopause. So we were saying, do you have low libido? Are you tired all the time? Are you suffering from anxiety? These kind of things. Then you could be perimenopausal or menopausal. Please make an appointment. If you'd like to make an appointment to discuss this, please come in. And we got so many patients booking appointments. So it got to the point where I wasn't able to sustain that within my GP surgery, because obviously there's the normal standard patients that we have in the practice, and I share that practice with my husband. And so I decided to start a separate clinic, and here we are. Yeah, so it's been brilliant, like really, really good. Yeah.
Can I ask, when you were studying medicine, and forgive my ignorance, because as someone who's never studied medicine, don't know how it's taught, but were there any like modules or anything where you had to like study menopause kind of specifically, or was it kind of not swept under the rug, but kind of brushed over kind of very generally, this is kind of the norms, this is what we're supposed to see, and just move on from there type thing?
Yeah, absolutely. So it was extremely quick. I don't really remember it being any really significant fact at all, except perhaps definition of menopause, and one or two symptoms, and that was really it. Like, so much more of a focus on, and to be honest, like not a great focus on, say, gynecological health in younger people, for example, so teenage gynecology, or and again, actually something which I find well, it's not extraordinary, but things like transgender issues and things like that. So we didn't, it was just not part of our curriculum at all, and I really don't know if it is yet. And I think that, I think even transgender is even the worse off relative of menopause, because again, it's still hormones. But there's a lot of stuff we're not taught in medical school, and then you come out and you're expected to sort of feel your way through it. And that can be very difficult. And I suppose the only other thing we were taught was stay away from hormones in terms of HRT. So that was anything we did get taught was quite negative about it. So to the point that I came home to my mother and was like, you need to stop taking your HRT, you're going to get breast cancer. And she was like, don't talk to me about my hormones, young lady. You're not even a doctor yet, so go away. And she just carried on doing her own thing. So she wasn't very easy to convince. And as it turns out, she was right. So so she can't understand the furore over HRT and not taking it and all these kind of things, because in her day it was very standard, you know.
Just to clarify, is HRT hormone replacement therapy, yeah?
Hormone replacement therapy, yeah. So that's kind of giving yourself back the hormones that you lose when you transition from pre-menopause to menopause, yeah.
And just to ask as well, growing up in a kind of a family of medics, were you kind of taught more, like with your parents? Did they kind of teach you this what you might expect to happen when you grow up, or was it also kind of not really spoken about as you were, like, you know, when you're a teenager, or when you're kind of even during your medic studies?
So my family is probably quite bohemian. So there's 4 in my family, so 1 brother and 3 sisters, and then my mum and dad. My dad's passed away now, but at the time, and I don't know if anything was ever off the table in terms of conversation. You know, so my mum menopaused in a very visible fashion. So you know, we would have seen the patches that she used for her hormones. Even things like periods, like the tampons and sanitary towels were just left in the bathroom. No, there, you know, because it was quite an Irish thing to hide it. You know, it was quite shameful to bleed, or shameful to, those things were very much women's matters and were discussed in quite hushed tones with very specific language, you know. So, and it was, you know, the curse or this kind of stuff. Whereas in my family, it was much more kind of, you know, just, it wasn't a big deal at all, which I think is a really nice way to do it. And it's made, like, even my brother, actually, he's, what age is he? He's like early 40s now. And the Davina McCall program was on, and my brother texted me and said, are you watching the Davina McCall program about menopause? And I was like, are you? And he was like, yeah, it's really interesting. So, and I thought, and that's kind of the way he would always have been. You know, he's very comfortable with women, and he's very comfortable with women's issues. And I think that's because it was always open season in our house. So to the point that my parents were like, oh my God, can you just not talk about like genitals, or, you know, just try and keep the conversation clean, you know, if we had visitors over or whatever, because they just never know what we'd come out with. So, but I think that's made my job much easier, because like, it doesn't bother me talking about any of that stuff. So I'm often discussing sex lives with women in their 40s and 50s, and many of them, it wouldn't have been standard to talk about that kind of stuff. And some of the women are even older. And I think if you're comfortable to talk about sex and, I suppose, female pleasure, particularly in that age group, and the importance of maintaining your sex life and things like that, like, it doesn't bother me in the least. So I think that makes, because I'm obviously not bothered, then I don't think patients are bothered as much either. So we have a bit of a giggle, and people feel more comfortable at saying things, I suppose. So in some ways, it came in handy in the end.
Yeah. And before we get into like the detailed questions, for some people who are listening, could you kind of give like a doctor's definition of what menopause is, and kind of, you know, what someone can expect to see or experience? But you know, so that before we go into, we've kind of got it set up, and people know exactly what we're talking about. Yeah.
So I suppose menopause is the cessation of your menstrual period. So, and the end of your reproductive life, I suppose, as the female. And women menopause in different ways. So most women will transition through menopause into perimenopause, and then go into menopause. And I suppose a lot of people say to me, I thought I was over the menopause. And you don't get over the menopause, you go into the menopause and you remain in the menopause. So you'll always be menopausal, you'll always be postmenopausal, you won't really be through your menopause, because say your hot flushes and stuff might go away, but your bone density is still declining, your cardiovascular system is aging and things like that. So cessation of menstrual periods. And the other way it can happen is surgical menopause. So for example, somebody who had a hysterectomy where they took out their ovaries, or they took out their ovaries and their uterus, or just took out their uterus. So they can do different variations, but a surgical menopause essentially for most women will be removal of ovaries and uterus. And when you have a surgical menopause, it's like it's like a juggernaut of a menopause. So you essentially hit the wall. You've hormones one day and you've none the next. And that is probably the hardest way to do it, you know, particularly as many women had their ovaries removed and they were sent home. You know, they didn't have any hormone replacement. They could have been any age from, God knows, it could have been any age, but probably some of them were in their mid-30s and sent home postmenopausal, and that not managed at all, which I think is an absolutely, it must be incredibly difficult to do. Then other women will menopause from radiotherapy, so for cancer treatments like cervical cancer, rectal cancers and things like that. So those women will have irradiation of their pelvis, and that causes, firstly, their ovaries shut down, because the ovaries are very... the cells in the ovaries have a very high turnover rate. So when you irradiate those, they stop working. And again, those women, they may remain in menopause, or they may, the ovaries might kind of come back around again. And then other ladies getting treatment for breast cancer, they will menopause as well if they have breast cancers which are estrogen or progesterone receptor positive, because they'll be put on to hormone blockers, and that will put them into menopause. So not only are they dealing with breast cancer diagnosis, the surgery, the chemo, all the rest of it, they're also most of the time dealing with menopause. And that's just incredibly tough. I can't imagine how hard that must be. And then other women will be maybe born with genetic abnormalities, or for various other reasons, autoimmune disease and things. So women may menopause really early with those kind of symptoms, or those kind of diseases or syndromes, and some of them may never get a period at all. So those women don't ever go through normal menstrual cycles. So those women need to be picked up and given hormones so that they can, have I suppose a normal life like all the rest of us, I guess.
And what are the signs of someone who's going into menopause who maybe they're not sure, it's just like a period in their life, or is this menopause that they don't really know? What are the more common signs we should start with, and then maybe some of the less common ones, like the ones that you posted on your Facebook page?
Yeah. So first of all, when you're actually formally diagnosed as postmenopausal, you have to have had no vaginal bleed for 1 year if you're over 50. If you're under 50, generally speaking, you need 2 years. There's kind of like variations on that. Some people say 1 year, some people say 2 years if you're under 50, but certainly until recently, we would expect you to be 2 years under 50, 1 year over 50 with no vaginal bleeding. And those are women who aren't on like a hormonal contraception or something else that will stop their period. So absence of periods, I suppose, is the most well-known sign of menopause. But menopausal transition can start like up to 10 years before you have your last period. So if you have your last period, on average in the UK is 51. So from about 41 onwards, women may start to find that they're beginning the menopausal transition. And what that means is that they're just kind of, their estrogen levels are kind of eking further down. So they're not functioning on as much estrogen as they did in the past. And I suppose we would have had a very typical idea of menopause as, period stopping, hot flushes, and being a bit narky, and that would kind of, you'd imagine the kind of, is it a parody? Is that the word? When they show menopausal women in comedy and stuff like that, it's like the old lady walking around in her apron giving out to people, and this kind of this sort of stuff going on. But actually a lot of the menopausal symptoms, particularly in younger women, will be less hot flushes and more like anxiety, poor sleep, difficulty coping at work, sort of feeling overwhelmed a lot of the time. Palpitations are extremely common. So an awful lot of women will end up getting ECGs, angiograms even, like they'll be getting quite invasive investigations done for hormonally caused symptoms. Other things they can get: weight gain, loss of libido, vaginal dryness. I'm trying to think of some of the other things: irritability, low mood. So lots of, there's about 30 something recognized symptoms of menopause. So I suppose when we talk about so hot flushes and absence of periods is probably some of the ones that aren't as life altering, if you know what I mean. So I suppose people getting a lot of anxiety, that can be really, really disturbing to your life. Other people get numbness in their fingers and toes. They get muscle twitches. They get a feeling of skin, things crawling under their skin. They get gastrointestinal disturbance. So I suppose, like, when you think about it, like, your menopause will affect you from the top of your head to the tips of your toes, because you have estrogen receptors through your entire body. So when you start to lose the levels of estrogen, it's a free for all in terms of where you might get symptoms. You know, it could be anywhere. So I think it's, and the problem was that we weren't recognizing these symptoms as perimenopausal or menopausal symptoms. So women would come in and we'd say, well, are you still getting your periods? And they'd go, yeah. And they go, are they still regular? Yeah. And they'd be like, well, it's not your period then. It's not your menopause. And in actual fact, it is. And we can't test for that, really. Do you know, it's more of a clinical diagnosis. So if we tend to do bloods in women under 45, just in case there's something else going on that we're missing, like a thyroid issue or something like that. But by and large, those blood tests are normal. And then we get a questionnaire filled out called the Green's criteria. And we use that questionnaire for the most part to diagnose whether women are likely to be perimenopausal. Particularly, obviously, postmenopausal is easier to tell because they don't have their periods anymore, you know. And then we decide on treatment plans according to that, really.
Cassie, am I right in saying that the most common way in which you can kind of ease the symptoms of menopause would be HRT?
So the most effective way is definitely HRT. There are other
okay.
There's lots of lifestyle things that you can do. And I'm a massive fan of lifestyle stuff. Like, I could listen to or read lifestyle podcasts or books, or I just find it really fascinating, you know, all the different, and even the stuff that you've done in the past. Like, I'm really interested in, like, dementia and sleep and all these different things that and exercise and everything as an entirety to make us the most healthy and best people we can be, you know. So, and menopause is very like that, you know. So a good menopause, you're going to have a good or a better menopause if you modify your lifestyle. And I think mid 40s to mid 50s is kind of a real transition time. Like, I was at the dentist today getting at the dental hygienist actually, and we were talking about looking after your gums and looking after your teeth. And I was saying to her that I only really managed to do that properly probably into my sort of late 30s, into my 40s, because I think you're just more organized, you're better settled, you recognize the importance of doing these self-care routines and how doing things right now will pay off into the future. So I think mid 40s is a great time to kind of start to get all your ducks in a row. So stopping smoking, massively important, because women who smoke have worse menopauses. They have way more hot flushes. Their cardiovascular systems are generally not as good. Their bone density issues are a huge, big deal as well. So stopping smoking for anyone, male or female, no matter what the age, it's the best thing you could possibly do for your health. But certainly in menopause, it's going to make the menopause transition easier. Looking at your alcohol intake. So when we talk about HRT, there is a very small increased risk of breast cancer if you take HRT for more than 5 years. So that's roughly, at the very most, 4 additional cases of breast cancer per 1,000 women over 5 years. So it's probably about 1 extra case per 1,000 people per year. So if we compare that to drinking a large glass of wine every day, that would have a breast cancer risk of 5 additional cases per 1,000 women. So it's more dangerous to take 2 units of alcohol a day than it is to take HRT. And yet women do that all the time. So I'm not a killjoy, like, absolutely, if you want to drink, no bother at all. But look at how much you're drinking, how often you're drinking, and certainly, you know, that alcohol in excess or above the recommended limits will also make your menopause more difficult. So if you drink alcohol, your hot flushes tend to be worse, your sleep is worse, your anxiety is worse, your low mood is worse, that kind of thing. So obviously not if you're doing it in moderation, but looking at your alcohol consumption, because women are drinking more than ever. And I think we need to look at the normalization of wine o'clock for women, particularly of my age. where it's become, you know, like fridge magnets promoting alcohol for women. You've pink drinks, pink gin that's aimed at, you don't see men drinking pink gin. Well, you might, but not as often as you see women. You'll see rosé. I was in a cafe the other day and I was pointing at my daughter's 10 and I said, look at that bottle of wine over there. That is made to get you to drink it. Just you, not the boys, just you, because that is alcohol designed for women. So I think waking women up to what advertising is doing to get us to drink more. So if you watch like particularly like say Love Island or something like that, or detective shows or this kind of thing, when you get to a break on that, there will be a lovely, beautiful, glamorous woman pouring herself a huge glass of wine, and you'll go, God, I'd love a glass of wine. Look at her. She's having a glass of wine. She's hungover. She's got a lovely figure. Look at her beautiful kitchen. Like, it's immaculate. So I think I'll have a glass of wine, you know? So so that's something I really do ask women about their alcohol intake. And if that's an issue, I have we often, that could be what we talk about for the vast majority of the consultation. Weight is another thing. So weight and exercise. So if you do regular exercise, for example, that will help your menopausal transition too. So women who exercise regularly, particularly things like yoga, quite relaxing types of exercise, again, there's some evidence to show that your menopause in general is coped with better. It's all the stuff that we already know, do you know, losing weight. So women who are overweight have worse menopause. They also have a much higher risk of breast cancer. So if you're considering HRT and you're worried about the breast cancer risk, you're much better off losing the weight and taking the HRT, because if you're overweight, if your body mass index is more than 30, you have an additional, I think it's 24 or 25 cases of breast cancer per 1,000 women. So like vastly more than HRT would ever do. So I suppose looking at the different things that we can change in our lifestyle and putting those into place in a way that works with the way we live, I suppose, would be really important. In terms of non-medical management, like taking things like sage or black gohash or these kind of things, there's red clover, there's all sorts of like herbal things that people will take. There's not great evidence for them. Maybe because there's not a lot of money in the companies researching things like sage, could be. So, because I see quite a lot of women report reduced hot flushes with sage. And I meet a lot of menopausal women, so I'm interested that seems to come up again and again and again. But we don't have good quality evidence to say that definitely works. High soya diet probably works, but we'd probably have to live in Japan to really get to get enough soya of good quality into us to reduce our hot flushes and things like that. So so all those kind of things can help. So it's not just hormones, and it's never just a hormone conversation that I have with women. You know, I'll always, I get them to fill in a questionnaire and I'll have a look through it and I'll pick out the things that I'm thinking are specific to them and specific to their risk and which might help them in their menopause, whether they make a decision to take HRT or not.
Can I ask a really ignorant question? Is there a possibility to like, how can I frame this? To kind of push forwards or push back, I suppose, your menopausal like period. So let's say like at birth, if you imagine that we all have like a body clock. If at birth, God grants you, and he says your transitional period is going to start at 36. Is it possible that if you kind of implemented some of the things that you were saying before, if you were never really a drinker, if you always like did yoga and all the rest of that stuff, could you push that transitional period from 36 to 41 or to 42? Or is it kind of like your period is set out from birth and all you can do is then manage it better once it comes into play?
So I think there are... So women who smoke will menopause earlier. So for example, because it's toxic to the ovary. So certainly we know that menopause will be brought on sooner by smoking. I think it stands to reason to imagine that making healthy lifestyle choices will probably extend your reproductive life, but I don't know definite evidence to support that. And I do know, very healthy women who've done everything, I suppose, in inverted commas, right, and will still, for whatever reason, end up menopausing at 40 or something like that. So, in fact, I can think of a friend of mine who that happened to very recently. And I was actually chatting to her last summer about the menopause clinic, and she was going, "Geez, I'll be on to you in 10 years." And then she sent me a text going, "Oh my God, I cannot believe it." It's like, I feel like she must think I gave it to her or something. But she was absolutely gutted. And this girl had she's like super fit. She's like not overweight. She doesn't smoke. She doesn't drink very much. She had 3 kids, no bother at all. So I have no family history. Menopause came like an absolute bolt from the blue. So yeah, so I think, but I also think, and I'm sure you agree, that doing those healthy lifestyle things, it's so worth it anyway, you know. But yeah, I would imagine it probably prolongs lots, not just menopause, but like we know it, if you make healthy lifestyle choices, you can potentially push a dementia diagnosis a little bit further down the tracks. Potentially you might push your first heart attack further away. You know, there's lots of different, or maybe stop it happening. Bone density issues, maybe maintaining your bone density by not smoking, not drinking alcohol. And like a fractured hip, for example, is life ending within a year for about 30% of women. So if you fracture your hip, you're likely to die within, or 30% of women will die within a year of a hip fracture. So it's no small thing, you know.
No, I had no idea about that, I'll be honest.
Cassie, can I ask? Obviously, this is a time where science is very much in the spotlight, and you're talking about, we don't really have science for this, or we don't really have good evidence for this. Do you remember just a few minutes ago you referenced how you came back when you were in university, and you came back and you saw your mom taking the HRTs, and you said, "Don't take them because they'll probably give you breast cancer."
Yeah.
Is that because at the time the belief was like there was reasonable evidence, or was it just a bit of kind of a period where there wasn't hardcore evidence either or, and there was just people promoting one way of looking at it and promoting another way of looking at it?
No, so 20 years ago or thereabouts, so roughly around the early 2000s, 2 very, very large studies were published. One was called the Women's Health Initiative, and the other one was called the Million Women Study. And those studies linked HRT to breast cancer. And from then on, it was an absolute free fall. So basically, many women threw their HRT in the bin, and just stopped taking it there and then, because the link to breast cancer. And in the years since those studies were produced, and that resulted in millions of women losing out on good menopause care and maybe suffering with these horrendous symptoms. For without really needing to, and without having good information about the risks of HRT. So those studies came out, and that was roughly the time I was in college, and the feedback was, avoid HRT if you can. If you have to take it for the shortest time possible at the lowest dose. So I was straight up the road to Enniskillen and saying to my mom, stop these patches now. You can't, it's going to give you breast cancer. So, and as I said, she didn't. And then since then, over the years, bit by bit, we've learned that these studies were not very well reported, and they overstated the risk of breast cancer with HRT. And adding to that as well, that the types of HRT we now use are much more body friendly or breast friendly than the stuff that we would have used in the past. So in the past, we used things like pregnant mare's urine to make synthetic estrogen to give to women. And now women loved it because it was a great estrogen. It made them feel really, really good, because that, when you're estrogen deficient and you give estrogen back, for many women, it's life changing. They feel so much better. But this type of estrogen was synthetic. It was given in very high doses in these studies. In one of the studies, the average age of women who were receiving HRT was 62. So that's about 10 years postmenopausal, and is a good bit later than what we'd normally give HRT. So high doses, given orally, it was synthetic. And so lots of differences between what we do now and what was done then. But we don't have good up-to-date studies yet to say what is the modern HRT breast risk. So we know it's very likely to be a good bit less, but we don't know exactly how much less. Yeah.
Thanks for that.
Yeah. And the other thing
I'm just so fascinated.
Yeah, I was just going to say the other thing with HRT that we talk when we like, a lot of patients will say to me, they hear the word HRT and the first thing that comes into their head is breast cancer. Straight off, they don't think of anything else. So, and the thing we have to remember, so yes, breast cancer is a risk with HRT if you take it for more than 5 years, but there are also really good benefits from HRT. And I think that that when I meet women in the clinic, they're well educated. They are women who are very well able to make a decision for themselves on what they would like to do with their own menopause care. So they don't, what I do is I give them the information and then let them decide on whether they want to take HRT or not. Nobody has to take HRT. It's not something like if you've diabetes, you have to take insulin. So nobody has to take HRT. Each woman has to make this decision for themselves and what they're most comfortable with in terms of risk and benefits. So when you take HRT, you reduce your risk of osteoporotic fracture in the region of about 30 to 40%. You reduce your cardiovascular risk. So your risk of heart attack and stroke will decrease by roughly the same amount, sort of 30 to 40%. There is some evidence to suggest that HRT reduces your risk of dementia. We don't really know if that's a definite, but it looks likely that it is the case. It seems to be dependent on when you start it. So it seems to be more beneficial when it started in the perimenopause and not postmenopausally. So it's almost like it's better to put estrogen back in when you start to lose it rather than waiting for you to run out. So estrogen seems to be, and we also know that if you had a hysterectomy and removal of your ovaries in your 30s and you weren't given estrogen replacement therapy, your risk of dementia is vastly higher than if you had not had your hysterectomy, or if you'd had a hysterectomy and been given back your estrogen with the patch or gel. So that's the benefits of it, I suppose, as well, is worth noting.
Thanks a million for that, Cassie. This is very informative. I really want to talk about like stigma and what we can potentially do, like as men who don't experience this, to help the women in our lives with that process. But before I touch on that, are there any other misconceptions or in and around menopause that we haven't touched upon that it would be nice to just knock out of the way? Like that's nonsense, or that's often thought of, but it's not true.
Yeah, I wrote this down earlier and then I think I forgot to take it with me because I thought it was an interesting question. I suppose that I guess this idea of menopausal women as being sort of over the hill or past it or something, because I find menopausal women are, a force of nature. They're running big companies. They're very, they've tons of ideas and plans, and they're starting new businesses and they're doing all sorts of stuff. So I think, and I think sometimes we feed into that narrative, that we lose confidence in ourselves and we don't put ourselves forward for promotion and we don't think that we're able to cope with the jobs that we're in. And I think when we get your hormones sorted out, you realize that you're actually still the same person. You're still well able for the job you're doing, and you probably have more experience than anybody else doing it, So I think that's important. I think myths are, that like you have to be old to be menopausal. I think that's a bit of a myth, and like I said earlier, things like that, it's just a few hot flushes and a bit of grumpiness. I think that we have to recognize menopause as an enormous amount of symptoms and kind of be aware of them. And I think women need to be educated so that when the wheels start to come off, they know what's wrong with them, so they can manage it,
Thanks for that, Cassie. Even when I was reading that potentially women who had never really suffered with anxiety could then have a pretty significant issue with anxiety as a result of the onset of menopause, you think the impact on mental health would have been huge.
Well,
and that many women don't really have the preparation for this. Yeah,
well, when you think about women and mental health, so where did they get the word hysterical from? Is to do with hysterectomy or like uterus. So this kind of idea of crazy women is centuries old, I suppose. And certainly the person who termed it hysterectomy or hysteria had some kind of inkling that women's hormones and women's health seem to have some kind of impact on their brains, do you know? And that's kind of a start of something, but we sort of seem to work that out and then just not work anything else out, which I think is a huge disservice to women. And I think this idea of like a crazy 40, 50 something year old women who are neurotic and hypochondriacs, and, you know, I really think that needs to stop. I think it's deeply unfair, you know, and I think that we need to recognize things like fibromyalgia is probably, for many women, is probably actually menopausal. Like for many women, they probably don't have fibromyalgia. They've probably got aches and pains from low estrogen. For women who are going in complaining of low mood and being put on antidepressants, they're not depressed. They're just hormone deficient. Not all of them. And some people need both. But I think we need to open our eyes to the fact that from 40 onwards, the women coming to us as general practitioners or into any branch of, you know, caring for people within a service, even what you're doing yourself. So women who have, say, within disability services and things like that, like those women menopause, and you know, who speaks for them, you know? I had a lady once in GP who had moved over from Bangladesh, and she didn't speak English, and it took so long. She was very young, and actually a lot of Indian and Bangladeshi women and Pakistani women tend to menopause a little bit earlier than we do. So she had menopause very, very early, but because she didn't speak English, and I obviously don't speak Bangladeshi, I'm not even sure what they speak there, but
Bengali.
Yeah, I don't really know what it is, but she had this lovely daughter who came in, but I didn't know the questions to ask, and they kept going, she has fevers, she's hot, she has fevers all the time, and it took ages, and she must have been in and out for about a year, and I was like, oh my God, she's menopausal. And because she was only in her 30s, it took me so long to diagnose her. And it was before I was kind of doing this. It was a couple of years ago. And I was like, it was like a light bulb came on. I was like, of course she thinks she's got fevers because she's bloody boiling all the time in the middle of Ireland, you know? So I just remember thinking that was, really interesting. So those kind of women as well, you know, people need information in their own languages. They need perhaps people that they can talk to in their own languages about their symptoms. They need good translating services so that they can come into a doctor and really tell you what's going on. And if that, you know, if those things are put in place, I think that would be an amazing thing for women, because I think that and like I said, women coming in saying, you know, I feel depressed, or I feel anxious, or I've got my fingers are numb and my toes are numb and my hair is falling out, and instead of going, oh my God, what is with all your problems? Why don't we go, what could possibly be bothering this lady who's 45 to 55? You know, what could possibly be going wrong that's making her entire system malfunction? And if we just sit back for 2 seconds and look at the patient, that question will probably be answered for us, you know, or the patient will probably tell us, you know. So I think that would be a brilliant thing for women. You know, I think it would be great to see that change happening. And I think we're going to, you know, it would be brilliant.
Absolutely. I guess I wanted to ask, have you noticed a difference even, say, like the last 12 months or so? Do you feel like it's less stigmatized? It's more in the open space? Yeah,
I do. It's actually been a really interesting time, you know, for me working where I'm working, because it's things like particularly women who work with other women. So you tend to find in teaching profession, there's an awful lot of women, nurses. So the nurses, obviously most nurses are still female. So they will tend to talk to each other on breaks and shifts and stuff. And so one person will get their hormones and then they're like, do you know what's wrong with you? It's probably your hormones. And then like somebody else is going, oh my God, I never even thought about that. And, you know, that, and I would kind of encourage people to say to them, you know, say this to your colleagues, you know, if you see your colleague, because now you find yourself going, oh God, that poor woman, she's so menopausal. You know, you'll see the woman in Centra buying her groceries and then she can't find the purse and she's getting all red from here up and she's like, you know, and you're going, oh God, would somebody just give her some help and give her some hormones, or, you know, or just, you know, tell her it's okay. And I think what guys can do or men can do is to make it okay to say to somebody, you know, if you're working with a lady who is menopausal, that she can say, oh God, because brain fog, where your brain just glitches, and you forget your words, or you walk into a room and you don't know why you're there and stuff like that. I think in a work environment to say, it's okay for them to say, oh, so it's a menopausal moment, or I'm bloody boiling, can I just open the door because it's my hormones or whatever. I think if we make it a very normal topic of conversation where people aren't embarrassed to call it out, then then we'll be doing an awful lot for everybody.
Absolutely. Seb, does your mum ever talk about it with you?
No. Before this podcast, I would have said she's over it. Obviously, I now know that is not the case. But there's definitely a period where it was kind of more pronounced, just in the sense of all of a sudden, like the French doors be flung open and it's like December, and you're like, what's happening here? And she's like got hot flushes, and you're like, oh, okay. Or she'd have to sometimes we'd have to go for a bit of a lie down, like at whenever, like, I don't know, 2 p.m. on a Saturday, do you know what I mean? When normally she'd be up and about doing stuff, but she'd just have to take a bit of a rest. She started taking like naps and stuff. But it wasn't majorly spoken about. I don't actually know if she ever did hormone replacement therapy or not. I couldn't actually tell you. But I was going to ask, you said there, like, to make it what men could do, we can make it easier for it to be like a topic that's spoken about and brought up and not kind of, bring stigma onto it. But I wonder how a man could actually, not say that we can't do that, but I just wonder what are the realities of that, how we could do that. Because what I would imagine is like a man being like, oh, you menopausal, or like, it's all right, don't worry about it, something like that, and maybe getting shot down. Like, do you know what I mean? Like, well, you're not right, you can't be saying that to me. Because I think as well within a lot of women, like my mum and I'm sure many others, it's like there's almost a bit of a stigma within themselves. They don't want to bring it forward anyway. They're kind of like, well, I can cope. Yeah. I'm a boss. I'm this. It doesn't matter about my hormones. I get on with it. So I feel like it might be dangerous territory for a man to almost bring it up first. But I don't know how you welcome that on, in a obviously in the home relationship, of course, where you've got that open dialogue, but in a maybe more professional sense, I don't know how, as a man or as a colleague, you could kind of bring that conversation on without potentially overstepping the mark or being seen as like making a remark that wasn't, okay in the office to make or something along those lines. Yeah,
I know what you mean. It's a bit like saying, oh, got the painters in, the way they used to, with periods and stuff. It would be, the way men, time of the month is it or something, which is obviously deeply offensive and was
of course.
Like when I was growing up, like the teenage guys would be saying that kind of stuff to us all the time. Or you on the rag, or there'd be all these like horrible expressions for like if you lost the bap about anything, it would automatically be assumed that you were having your period. And I was like, well, no, you're just annoying. So it's not because I've got my period, because you're just annoying. That still happens. So I know what you mean, and or it's a bit like asking someone when the baby's due when they're not pregnant. So I can understand how there's or offering your seat or something when they're not pregnant. So I know what you mean. I suppose in some ways. So say if you were working in an environment that you could. If you were in a managerial role where you would say, well, could we have like a menopause policy? There is that kind of stuff going on where to put things in place there. And I don't know if that's even things like allowing somebody to sit beside an open window or stepping out of a meeting, or I'm not really sure what there's certainly there are women who specialize in menopause policy, setting it up and all that kind of thing. I guess even sort of seeing it happen, but seeming like somebody who would be open to conversation or whatever. But I don't know. I think my feeling is that you're not going to have to bring it up. I think women are growing in confidence where they're feeling that it's okay to bring this up. And I think that it's funny. So women will say to me things like, I was chatting to my mum about my menopause or her menopause, and she said like she hardly noticed it. And I was like, oh, right, okay. And I was like, women are amazing, because we're really, really designed to forget loads of hormonal stuff. So when we have a baby, it is flipping agony. Like it really is so incredibly sore. And then you go off and 6 months later, you're going, cheapers, do you know, I wouldn't mind another baby. Like, they really are. They're lovely, aren't they? They really are great. I think I'll do the whole thing all over again. And then you're just like going to the maternity unit and you're like, oh my God, what am I doing back here? You suddenly are going, God, I remember this is so bad. Why am I here? And at that point, you're already on the slide. So you've got to have the baby. And then 6 months later, in my case, nearly, you're like, God, that was great. I might have another one. So I think when it comes to hormonal events for women, they have a great ability to kind of forget, or to minimize what they went through. And I think we're designed exactly that way. So we keep going back and having more babies, because ultimately we're designed to make babies. That is our biological, whether we want babies or we don't want babies, our body doesn't know that. Our body just thinks that's all we're here for. We're as bad as coronavirus. We're just here to make more of ourselves. And that's our sole job. Now, so obviously we up here, we know that there's so much more important, that women are not just here to make babies, but our biology is a very strong driver towards reproduction. So when we have a baby, we walk away and we're like going, that wasn't so bad. That was grand, and very soon we forget it. So I think we're a little bit like that with our menopause, where we go through this awful hormonal turbulence. And once we're kind of through the hot flushes and the poor sleep and all the rest of it, I think we have an ability to reflect. Like, so our mothers go, oh, wasn't that bad? Actually, I didn't really notice it. I barely noticed my menopause, and then their daughters will be like, oh my God, she was like a flipping banshee for like 10 years. I couldn't even look at her. She was so bad tempered. And the mother will have kind of forgotten that, so I think this kind of saying, no, my menopause is grand. And then my mum said, yeah, my menopause is fine. And my sister was like, that's because you took hormones for like 20 years. So like, you didn't even actually have a menopause. So, so I think that's, I think whereas I have a lot of women now saying, for example, they can't believe how bad they feel menopausing. So they're really determined to talk to their daughters about menopause, and they're really determined to talk to their sons about menopause. So like, I'll have women who have like 3 boys at home and they're going, well, I am going home and I will tell my sons exactly how difficult this is. And I will have this conversation with them so that they understand menopause. And then when they have if they have a wife in the future, or a girlfriend or a colleague or somebody else who's menopausing, then they'll understand more about it. So I think it's going to come from the women, and they're going to open that conversation to the men. By the time I think future generations, they're going to be more comfortable.
Yeah, I think probably like a silent understanding, especially like in the workplace, is probably best. Exactly, and then just let them come to you, rather than if they start forgetting things, or like they nag at you all of a sudden, it's like out of character, just chalk it up to menopause without actually like trying to confirm it. Just give them the benefit of the doubt, and then if they come to you, then that's great. If not, just stay silent, keep your head down, and just try and be as understanding as possible. I reckon is probably the best vote.
Bring them a cup of tea. They'll think you're great.
Does that help on the hot flush? Would they be likely to throw it back in your face?
It'll have gone by then. Or you can bring them, hedge bets and bring them an iced water.
Both, like an iced water and a cup of tea.
Preferably decaf. But I think you're right. I think a silent understanding of it, that you're not just like, oh, jeepers, Joyce is such a pain, like she's always losing her bap, and you see how red her face goes and this kind of stuff, because funny, hot flushes, the more you think about them, the worse they get. So they're kind of like, so actually CBT can work quite well for a hot flush, because if you give it airtime, it gets worse. Whereas if you just kind of go, oh, don't worry about it. Like, who cares if my face is red, or who cares that, then it can take its power away from it, So I think that's a good way to go as well. Like, the psychological management of it is important too. And obviously not everybody wants hormones, and not everyone can take hormones. So there have to be, and people can menopause perfectly well without taking hormone replacement therapy, and millions of women choose to do so and have done so for generations, but it's great to have options, and for women for whom perimenopause and menopause is particularly difficult, it's really, really good that we can give them something that makes them feel so much better, and I think doing the job I'm doing, I've never ever given out any kind of treatment that has the positive impact that this does. Like, I've never had so many women coming back saying like they feel like their old self again, or a lady emailed me this week saying my anxiety has completely abated. Like, it's amazing. Or women who haven't slept for years who are like, oh my God, like I have forgotten how good it is to sleep. Like, can you imagine that? Just getting your sleep given back to you is just incredible, and the benefits that good sleep is going to buy them down the road for their dementia risk. Or even short term, like you're much more likely to crash your car if you haven't slept properly, you know? So, so I kind of look at it as weighing up risks versus the benefits of like good sleep and all those kind of things as well. Like it's really, you know, it's quite powerful stuff. You can't have it though.
Totally. But I even as
my husband
we'll
goes like,
this one time.
Even as I think about it,
I should say my husband really wants.
I was going to ask, even though it's not menopausal, but I've heard like a few of the like a few of the podcasters that I've heard who are like let's say the elderly gentlemen entering their 50s and stuff. I know a few of them have gone on to like a HRT, you know, for testosterone and stuff like that, and they always talk about how it's like giving them more vitality and they're able to do more sports. And obviously they don't deal with like as what you guys go through with menopause. It's more just kind of like they just feel like they're getting older, and then this hormone replacement therapy kind of like gives them or some of their youth again. At least that's how it's like I've heard it over
like
podcasts and stuff. So yeah, basically they feel a bit like, this is nice, a nice little shot on the arm can do them dandy. But yeah, so
I think so. Women actually, so part of hormone replacement therapy for women is often testosterone as well, because we also produce testosterone, and testosterone is what gives us our libido and exercise ability and muscle strength and that kind of stuff. But I do think that menopause, I suppose, is something that needs to be spoken about as well. So things like erectile dysfunction, it's just not talked about particularly. I don't know, in Ireland, maybe England it's better, I'm not too sure. But erectile dysfunction, it's so common, and it can be a real red flag for other types of health issues. So erectile dysfunction in men is really commonly is a big risk factor for future heart attack and things like that. So and that's part of, I've listened to some really brilliant podcasts from men talking about kind of this similar stuff for men, you know, that when they drop their testosterone, their mood drops, their muscle mass decreases, their exercise ability decreases, their libido goes down, they get, you know, they find it hard to sustain erection and things like that. And that's a big deal. Like that's a huge deal. Those are massive things in men as well. So, and looking at their cardiovascular risk and their blood pressure and their prostate things and that, because women are used to going to doctors. We go for smear tests. We go for having babies. We generally are the people who bring sick children in. So we're very comfortable in doctors' surgeries, whereas men really aren't, you know, because you basically go in as children with your mother. Yeah. And then you don't go back again unless you know something goes drastically wrong. So I think we need to be bringing men in like mid-30s and saying, right, you know, is your dad still around? Has your dad had any heart problems? Do you have any cholesterol issues in your family? Like I've men coming into me at like 55 saying, well, I haven't been to a doctor in 25 years, so I'm like clearly as fit as a fiddle. And I'm like, really? Just because you haven't been doesn't mean there's nothing wrong with you, you know? So, and then they're smoking 20 a day and they're drinking too much and their cholesterol's like 9 and their blood pressure's off the charts, and you're just like, oh my God. So I think that making it normal for men to come to doctors and get like an MOT done or an NCT is really important, that we need to push that agenda in men as well as women, you know, that what we need to look after ourselves, you know.
Yeah, for sure.
Cassie, on a lighthearted note, I guess, to close, as a GP, have you ever come across like some medical marvels? Like you hear about their lifestyle and you're just going, how are you still living how you're living?
Oh,
you know,
absolutely.
like you're drinking, you're smoking, you're not drinking water, you're not exercising, you're not doing that, you're not, and they look okay, and they're happy.
Look, we certainly have like, God, I had a fella, he was in his 90s and he came into the hospital I was working in and he had a bowel cancer, and they were like, oh my God, there's just no point in operating on this guy. And he was adamant he wanted it, and he smoked like a trooper. And so you had to walk a really long way to smoke your cigarettes. in the hospital. So he went under anaesthesia, had this enormous tumour removed, and he was literally back up the next day, out smoking a fag, way down the end of the hospital. And I was like, you see, cigarettes got that man out of bed. Cigarettes saved his life. You see, look at that. No hanging around. So, or another guy who's in his like late 70s, maybe early 80s, and he rings me all the time because he gets stomach pain in the nighttime. And that's generally because he wakes up and smokes a cigarette, and then he just smokes them all night. So I'm like, if you just maybe just like don't light the cigarettes when you wake up at night, maybe you could drink like kefir or something. So he took up kefir as a hobby, and he thought it was the best thing ever. So he used to always go, Jesus, doctor, that kefir stuff's fantastic. Like this here. And then I was over visiting him, and he had so all he did was smoke cigarettes, drink Lucozade, and eat biscuits. And he was like into his early 80s. So yes, there are the exceptions to the rule, but yeah, if that was me, I think I'd already be dead. So yeah.
Does that give you? I just imagined, like, is that reminds me of like a teacher who has like the student who never studies but manages to get an A star. Does that like kind of give you like the red mist when you're like, Jesus Christ, I'm giving all this like advice to all of my other patients, and look at this guy here blatantly ignoring everything that I'm telling him to do, and he's one of the healthiest sluts about.
Yeah, these are the patients, though. Firstly, they're a great crack because you're just like, oh, for goodness sake, like you're ridiculous. And there's no way you'd suggest they stop smoking because you're quite sure it would kill them at this point. So you just don't mention the fags at all. But you have to kind of like that guy doesn't even put his cigarettes out for you to listen to his chest, but he's fab, like, you know, and he's totally compass mentis, like not a bother in his brain or anything. So I guess you get all sorts, you know, and then you get the really unlucky ones, and things don't go well for them. So, you know, it's a funny one. So it doesn't bother me at all. I kind of like that, you know. I like the fact that there's some winners out there that still do it anyway, you know. But I was laughing when you said like, I suppose the teachers the right way to like, yeah, but aren't like most people who are like billionaires like left school at 15 or something? So, you know, if you think of all these really rich people, like a lot of them didn't even get third level education.
Here's to us suckers following the rules.
Exactly. So if you really want your kids to do well, you probably need to get them out of
they didn't play by the rules.
15 or something like that. And
if they're healthy, get them on the fags early. Takeaway from the podcast.
Yeah, no, I'm a huge believer in healthy living. I have my husband's head absolutely wrecked with the endless like fatty mad things I come out with, but at the same time I do love the old fellas or the old ladies who were bucking the trends, because they're kind of the funnest patients most of the time.
Yeah. It's great to hear.
Well, Cassie, this has been amazing. Thank you so much for giving us your time. And
no problem.
I just hope,
thanks very much.
I know we talked about like best case scenario in terms of men. Sorry, I know we were talking about best case scenarios for men, but I guess I like the possibility of someone coming across some information like this about menopause, and then just lightly being able to like say to their mom or their auntie, like, just, you know, a quiet word like, oh, I know a bit about menopause. If there's an issue, like, do let me know. If you feel like you can't say it to someone, or you feel like, yeah, you can just chat to me about it, you know. I think that could go a long way, and I really appreciate the work you're doing. I really appreciate the time, and it was fun as well.
Yeah, I had a great time. Thanks very much for asking me. Have a nice evening.
No worries.
Thanks a million.
Thank you.
You too.